it will find me somewhere where I am. I don't want to go looking for it and go to a destination site. I want it to find me. I want it to be served up in a highly tailored, highly personalized fashion. Taking this trend one step further, somebody had mentioned this earlier. I think it was Lisa or somebody in the audience was talking about apps. We have moved into an apps economy. There was a great article in Business Week just a couple of weeks ago talking about how all of these large companies that we've interacted with over the years are now starting to play and deliver their message, their content, their information into apps that we're all using every day. And so, again, physicians are no different. They're out downloading apps, paying for apps, getting apps for free. We need to make a place for your content, your information, and your messaging in that particular area. So you saw this slide earlier where we were talking about the third screen. I'm going to suggest, and I don't know that we call it the fourth screen, but it's really about delivering your message inside of this third screen, whether it be in e-prescribing applications or reference applications used at and around point of care, in a highly tailored, highly personalized fashion so that when somebody is in there and they're searching on lipid or they're looking up A1C measures as it relates to the treatment of diabetes, that you have an opportunity to place your message and some tools to help that clinician manage his or her patient or communicate something to the patient about the condition. That's the next evolution in pharmaceutical marketing, and it's happening today, and we all need to figure out a way to leverage ourselves in that particular area. So with that, I'll pause for questions, comments. I think there's a question here.
You got it?
Hi, I just had a question about the electronic sample closet. What kind of uptake are you seeing on that? Is it really in an early adopter stage now, or are you seeing that becoming more mainstream?
It's a good question. I think I'll answer it from two perspectives. From the industry perspective, there's a number of larger pharmaceutical companies who have really embraced the closet, and others are looking at it. And frankly, the argument goes something like this. It's a dynamic between the sales side of the organization and the marketing side of the organization. And the sales side traditionally does not want to give up samples. And the model itself does not mean that your sales force has to give up samples. It's just we're out looking for new targets. The way this technology works is much like an ATM system. So a physician gets allocated on an individual basis how many vouchers or samples he or she can get over which periods of time. And then it's managed irrespective of which one of those distribution networks, whether it's inside of the UPMC sample closet or over on PDR.net or one of the other partners. As they're ordering their samples, their bank account is being decreased so that it's always managed. And the farm company could say, I want this person to get 1, this person to get 30, or I want this person to get 0 because he or she is called on by a rep, and that's the channel that we prefer to get the samples to. Physicians absolutely love it. It is building a service around them, with them at the center of the model, which, if I can argue one thing that pharmaceutical companies have done a poor job, a physician is a physician, and let's build our services around that particular physician. And why do they have to go to 6 different sites to try to chase 6 different samples? So physicians, I mean, the feedback and the surveying that we've been getting from physicians, including UPMC and others, is they love the service. We would like to get, obviously, more pharmaceutical products in there. The fees continue to come down as more farm companies come on board, where it becomes a very, very economical, certainly when you compare it to any of the traditional models of delivering pharmaceutical samples.
I'm sorry, I had one follow-up question to that. On the online sample closets that you've set up, I'm sometimes wondering if it is actually the physician that's going in and viewing and ordering their samples, or are they delegating that to a nurse practitioner? Because when the rep delivers, they know they're getting to that physician as much as they can. But online, there's a little bit of that anonymous nature. Have you done any research or have any insight as to how that's playing out currently?
Yeah, two points. Certainly, we do know that, that the physician staff is playing a role for the physician, but there are certain pieces of information that the physician needs to enter there. So we certainly believe in approximately 2/3 of the time we are getting the actual physician to actually do the ordering. The second point, and I might argue the one point where you say when a rep goes in there, they're always getting to the physician. The data that we have is more often than not, samples, vouchers are being dropped off with the office staff, and very little time is being paid actually with the physician. I don't have a direct comparison, but I would argue that they're probably fairly comparable in the amount of time the physician is getting in the electronic closet versus actually physically seeing a representative in the office. At least that's what our data tells us. Now you might have some different statistics as well. So, any other questions? Well, thank you very much.